Carlisle will be the first person to unpack. Welcome to Kate. That's really inappropriate because I can't dance. But thank you anyway. Good morning everyone. Well, what a wonderful gathering to be part of. A short while ago, say 2 years, I may have been here at an event like this in a very different capacity, covering this conference in my work as a journalist, but as we all know, a lot can happen in a year or two. For the past decade or so, excuse me, I've had a really bad cough the last few days. For the past decade or so, I have worked in broadcast media, in television and radio as a senior journalist and a news director, and the newsroom was my life. My job was to gather the facts and report them. Every single day was filled with writing stories, doing interviews and presenting bulletins live on air. In April last year, I found myself needing to call on these skills and then some for a very personal reason. I'd been feeling flat and really tired, and I just felt that something wasn't right. When I found a lump in my left breast while showering, I just knew that something wasn't right. Further investigations revealed a bigger lump in my right breast, and I saw no less than 8 medical professionals over the course of the next 4 months. All were very reluctant to recommend removing those lumps, as it was an operation that didn't warrant the scarring, and although pathology revealed abnormal cells, they weren't screaming malignancy. I was assured that it was just dense breast tissue and that at 31 I was too young. Perhaps my busy professional and social life and exhaustive efforts to keep fit and healthy were to blame. Then the IVF Centre refused to proceed with the next step in our efforts to have a baby. Those lumps they warned, if cancerous, could be fed by the hormones they needed to administer. Fortunately, my next stop was a specialist who didn't explain away those breast lumps and saw fit to remove them quite urgently, so I had a bilateral lumpectomy. 3 days later, there was a very dark and rather eerie mood as I sat in yet another waiting room. That evening, I was told that they'd picked up some changes. Those changes were DCIS, it was intermediate grade, and I would need another operation. When my surgeon asked how I felt, all I could say was lucky, thank you. I was so grateful that he had picked it up and that he was telling me there was something that could be done. That second surgery happened about a week later. The clearance of margins revealed a multifocal habit, and there were in fact 4 spots of cancer. The decision between a mastectomy and radiotherapy was a flip of a coin. I went to see a radiation oncologist who gave me plenty of stats, but they were all on women who were 20 years older than me. He told me the treatment he could offer would look after things for now, but they couldn't treat the other breast, which had already developed a lump with abnormal cells. They couldn't guarantee there were no more spots hiding in that right breast, and that if I suffered a recurrence, the breast would have to come off anyway. To save myself and my family that anguish, the surgery was for me the better option. He actually convinced me not to have the radiotherapy by saying that the surgery was too radical, like taking a sledgehammer to hit a nail. My decision was made. I wanted that sledgehammer, thank you very much. I had the bilateral mastectomy exactly a month after that first surgery, and I'll add here that the pathology returned 2 important findings. It hadn't spread to my lymph nodes. Lucky, huh? It also revealed a 5th spot of cancer. Lucky again, huh? Lucky I had grabbed that sledgehammer. My big op included the insertion of tissue expanders, which stayed in place for 5 months, and during that time I was really desperate for my body to feel good again. I got back into swimming, which I loved, and yeah, okay, breaststroke took on a whole new meaning. I also felt like my career was slipping away and went back to work. And I may have looked the same or similar, but obviously the clothes, the makeup and smile had hid the trauma that my body had been through. And to put it quite simply, I felt like I didn't fit. As glad as I was to get to the reconstruction, I really struggled upon reaching that point. I took an extended break from work to let my head catch up with what the body had been through. I also took a long, hard look in the mirror and had to accept that my now disfigured body meant that I was still here. I didn't go back to that prized position I'd spent my whole working life aiming to hold, and my surgeon, in seeing my distress at the end result, offered a further reconstruction, so a fifth operation to, as he put it, tweak things a little bit. And along the way, I had also come out with some odd boob jokes that always seem to come up at the most inappropriate of times, like the fact that I'm now packing plastic. I will never ever need to buy a push-up bra again. And even when the aircon is blasting freezing Arctic breeze, no one will ever know that I'm cold. Those funny bits aside, I had experienced a somewhat dark period in trying to address some pretty significant issues, including my diagnosis, treatment, battered body image, sexuality, fertility, and fears about the future. And finding the new normal, as you would all know, was the name of the game. And in reading through the program for this weekend, I'm really thrilled to see that each of these areas will be discussed. That 7-day-a-week, high-powered, high-stress job with 3 a.m. starts is no longer for me. And since my entry into Cancer World on a personal level, I have felt compelled not to waste this experience. I've now chosen to pursue a career in this field. An opportunity to work in community support and education programs at Cancer Council Queensland is going a long way to satisfying my thirst for information. Absolutely, I'm inquisitive by nature, but there now exists a level of interest which is unparalleled. It's exciting to be part of this very special gathering, and I do look forward to meeting as many of you as possible.